Welcome to this educational program. This module provides a general introduction to chronic prostatitis or chronic pelvic pain syndrome. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Prostatitis is a word that describes a spectrum of diseases of the prostate and pelvic area of men. This disease spectrum affects over 8 million males every year throughout the world. In fact, up to 1 out of every 2 men may experience prostatitis in his lifetime. The prostate is a chestnut-sized gland situated at the bottom of the urinary bladder, the place where urine is stored. It surrounds a portion of the urethra, the tube that carries urine from the bladder out through the penis. The prostate gland secretes a thin, milky fluid that nourishes and helps activate sperm cells. This slide shows how the prostate is associated with the male ejaculatory system. Sperm is made in the testicles and travels through the sperm duct or vas deferens to join the ejaculatory duct. Fluid from the seminal vesicles and prostate also passes into the ejaculatory ducts to bathe the sperm and create semen, which is expressed out through the urethra during orgasm or climax. Prostate fluid plays an important role in fertility by helping to release the sperm from the other semen fluid and allow it to move forward to fertilize a female partner's egg. What exactly is prostatitis? Simply put, it is inflammation or swelling of the prostate. Inflammation is the body's response to protect itself against injury or infection. Prostatitis can either be acute, with a sudden onset, or chronic and slow to develop. Symptoms of prostatitis generally fall into 3 broad categories: urinary symptoms, sexual symptoms, and pain. Urinary symptoms may include frequent urination, nighttime urination, an urgent or constant need to urinate, and a slow stream or poor bladder emptying. Sexual symptoms include things such as abnormal ejaculation or blood in the ejaculate. Pain or discomfort may be felt with urination or after urinating, during or after ejaculation, or it may be felt in the scrotum, testicles, rectum, back, or perineum, the space between the scrotum and anus. Other less common symptoms of prostatitis may include flu-like symptoms such as fatigue, fever, sore joints, etc. Prostatitis may affect an individual in a number of ways. Pain may make it difficult to sit comfortably. This may make it hard to function both at home and at work. Sexual symptoms may lower one's sex drive, and it can make intercourse painful. Some patients may feel like avoiding sexual relations altogether. All of this can lower one's quality of life and lead to immense frustration, depression, and anxiety. Take faith in the fact that you have identified your problem and are now on the road to fixing it. Chronic prostatitis is treatable. Prostatitis is not a single clearly defined condition. Doctors have identified 4 distinct prostatitis syndromes as listed here: acute infectious prostatitis, chronic infectious prostatitis, chronic prostatitis chronic pelvic pain syndrome, or CP-CPPS, and asymptomatic inflammatory prostatitis. These will each be discussed briefly, and the rest of this presentation will focus specifically on chronic prostatitis chronic pelvic pain syndrome, which is the most common and bothersome of the 4. Acute prostatitis, now called Category 1 prostatitis, is the least common of the syndromes and also the easiest to diagnose and treat. It is a true sudden infection of the prostate with bacteria or germs, causing severe urinary symptoms, pain, and fever. It is treatable with antibiotics, drugs that can kill or stop the growth of bacteria, and it usually resolves completely. Chronic infectious prostatitis, now called Category 2, is also a true infection of the prostate, where bacteria can be identified. It also causes urinary symptoms and pain, but they come on less suddenly and are less severe. This condition is also treatable with antibiotics. Asymptomatic inflammatory prostatitis, now called Category 3, is not an infection at all. In fact, this is a silent condition where a man has no urinary symptoms or pain whatsoever, but is found by chance to have inflammation in the prostate on a prostate biopsy or semen test done for other reasons. In these cases, treatment may not necessarily be required. Chronic prostatitis, also called chronic pelvic pain syndrome, is now part of Category 3 and is the most common syndrome. It is unfortunately the most troublesome to diagnose and treat. This is a condition of persistent or reoccurring urinary symptoms and pain, where no bacteria or other germs can be found in the prostate. Patients with this condition may or may not have any evidence of inflammation in the prostate at all. In other words, the process is not always localized to the prostate itself. Because of this, treatment with antibiotics does not necessarily cure the symptoms. Prostatitis affects men of all ages, but it is frequently brought to the attention of doctors by men in their early 40s and onwards. Between 4 and 16% of men have or have had this type of prostatitis, and at any given time, roughly 2 to 10% of men in the community have it. This translates to about 8 million outpatient doctor visits per year worldwide. Prostatitis symptoms are the most common reason for a man under 50 years old to see a urologist. How chronic prostatitis chronic pelvic pain syndrome develops is just now being properly understood. The condition begins with some sort of triggering event, which will be described further shortly. This event leads to inflammation and nerve injury. Inflammation is the body's response to injury, infection, and other stimuli. Inflammation and nerve injury, in turn, lead to changes in the nervous system, and in time, this leads to an abnormal pain response and to a cycle of chronic pain. Anything that can cause inflammation in the prostate can act as a trigger for chronic prostatitis chronic pelvic pain syndrome. This includes a bacterial infection of the prostate or bladder, a sexually transmitted disease, backflow of urine into abnormal ducts within the prostate, certain abnormalities of urination, or a nerve injury or trauma to the pelvic area. In response to this trigger, the prostate becomes inflamed or swollen. As noted, this is the body's normal response to infection or injury. This inflammation irritates nerves around the prostate and pelvis, causing pain and urinary symptoms. In most men, this reaction settles down. However, in some men, the inflammation in the prostate persists, or injury to nearby nerves in the pelvic area causes damage. A vicious cycle now settles in, whereby ongoing inflammation causes further damage to nerves, and damaged nerves in return can cause further inflammation. Once this cycle begins, chronic prostatitis can develop within weeks to months. This occurs when the problem moves from just the prostate and pelvic area to nerves in the central nervous system, in other words, the spinal cord and brain. Now, once these central nerves have been altered, pain will be felt in the prostate and pelvis even after all the inflammation there settles down. Because of this, treatment aimed at the prostate will not necessarily improve the situation. What we have now is a state called chronic or dysfunctional pain. Chronic prostatitis chronic pelvic pain syndrome is diagnosed using a combination of a careful medical interview, physical exam, including a digital rectal exam or DRE, and lab tests. The doctor's first goal is to rule out other treatable causes of the same symptoms. Other such possible conditions which may mimic chronic prostatitis include true bacterial prostatitis, a bladder infection, a sexually transmitted disease, an enlarged prostate, cancer of the prostate or bladder, kidney or bladder stones, and scar tissue or inflammation in the urethra. In most cases, your family doctor or primary care physician can evaluate and treat prostatitis. If there are specific concerns about your situation, however, you may be referred to a urologist, who is a doctor specializing in problems of the urinary tract and the male reproductive system. When meeting with your doctor, he or she will ask questions about your urinary symptoms, sexual symptoms, and pain. Questions about urinary symptoms include things like, how frequently do you go to the bathroom? Do you wake at night to urinate? Is there a great urge or a constant need to urinate? Has the stream changed? Do you have trouble emptying your bladder? Or is there dribbling after urination? You may also be asked detailed questions about your sex life, and how your condition is affecting your sexual function. Some men with chronic prostatitis may have pain with ejaculation, for example, and some men may limit their sexual activity because of such symptoms. Detailed questions will also be asked about the pain you may be experiencing, such as where exactly is it located, and whether or not pain is felt with urination or ejaculation. Your doctor will need to know when exactly symptoms began and how quickly they came on. Technically, the diagnosis of CP/CPPS is not made unless symptoms have been present for 3 months or more. Finally, it is important for your doctor to understand how your symptoms are affecting your quality of life and your ability to function at home and at work. Through this process of evaluation, your doctor may ask you to complete a questionnaire developed by the National Institutes for Health called the Chronic Prostatitis Symptom Index, or NIH-CPSI. This questionnaire not only can help your doctor to diagnose your condition, but to measure its impact and follow the results of treatment. Physical examination for chronic prostatitis includes a brief general examination, a focused exam of the abdomen and genital regions, and a digital rectal examination, or DRE. The prostate gland sits next to the rectum, so by passing a finger into the rectum, a doctor can feel one surface of the prostate and can roughly assess its size and consistency. He or she can also evaluate for tenderness in the prostate and for the presence of prostate lumps, or nodules. During the digital rectal exam, a doctor may press into the prostate and massage it. The purpose of this might be to collect prostate fluid for testing or to assist with urine testing for bacteria. Prostate massage is also thought by some, but not all, to be therapeutic. It is not done for this purpose routinely by most doctors. Urine analysis and cultures before and after prostatic massage are routinely done and are recommended. Urine cytology is also a recommended test. This is simply a urine test, whereby a specialized doctor or lab technician will look for abnormal cells in the urine to rule out bladder cancer. Optional lab tests include a semen analysis and culture, urine testing or swabs for chlamydia, a type of sexually transmitted disease, and prostate-specific antigen, or PSA. PSA is a blood test that measures the activity of the prostate gland. It is done if the DRE is abnormal or if prostate cancer needs to be ruled out. Sometimes helpful in the workup of prostatitis is an ultrasound, which uses high-frequency sound waves to produce images of the inside of one's body. For an abdominal ultrasound, a handheld device called a transducer is moved across your abdomen to show a picture of its contents. In particular, your kidneys and bladder are evaluated closely, including how well you empty your bladder after you urinate. Prostate ultrasound, also called transrectal ultrasound, is rarely done for prostatitis, but may be required in special circumstances. For this test, a probe is inserted into the rectum to take photos of the prostate and display the images on a screen. The size of the prostate can be measured, and abnormalities of the prostate can sometimes be detected. A cystoscopy is a special test occasionally performed in the evaluation of prostatitis, especially if there is blood in the urine or other conditions of the urinary tract must be ruled out. This procedure involves passing a small, flexible telescope with a lens and light to view the urethra, prostate, and bladder. The doctor will first numb the urethra or urine channel inside your penis with an anesthetic jelly, and then insert a small flexible telescope into the urethra. The images from the scope are usually displayed on a video screen, allowing the doctor to determine the size of your prostate gland and to rule out any other problems in the urethra or bladder. A urologist may also ask you to urinate into a special device called a uroflowmeter, which measures how quickly your urine is flowing. He or she may then measure the amount of urine left over in your bladder, usually with a portable ultrasound device. A slow urine flow or large amount of remaining urine may suggest bladder obstruction by the prostate or abnormal urination. Occasionally required in the evaluation of chronic prostatitis is a test called urodynamic studies. These are usually done in this setting to rule out abnormal urination or obstruction to bladder emptying. The complete urodynamic test is discussed in detail in a separate module. Simply put, This test involves inserting a tiny catheter, which is a long flexible tube, through your urethra and into the bladder. Water will be slowly run through the catheter into your bladder. Then, while you urinate, a computerized device will measure the flow rate and the pressure in your bladder. The procedure takes about 30 to 60 minutes in total to complete. There are many treatment options for chronic prostatitis, as shown on this slide. These are also discussed in much more detail in a separate module. Treatment of chronic prostatitis depends on whether it is infectious or not. A long-term course of antibiotics can successfully cure chronic bacterial prostatitis by killing or disabling bacteria infecting the prostate. For non-infectious prostatitis, the treatment options are less defined but numerous. Many physicians will prescribe antibiotics, even in the absence of positive cultures of bacteria. Antibiotics may actually slightly alleviate inflammation and make chronic abacterial prostatitis patients feel better. Frequently, antibiotics are combined with other treatments, such as prostate massage or alpha blockers. Prostate massage, as mentioned, is performed by a few doctors when there is no evidence of bacterial infection. It may work by relieving pressure in the swollen prostate by draining blocked fluids. Alpha blockers are drugs that relax the muscle within the prostate, which again may relieve tenderness and help to improve urination. Non-steroidal anti-inflammatory drugs, such as ibuprofen and naproxen, can help relieve pain and inflammation. These are used to relieve symptoms of both infectious and non-infectious prostatitis. Many alternative therapies have been tried, and some have shown some merit in clinical trials. Acupuncture for pain relief and plant-derived extracts from saw palmetto or quercetin may improve symptoms in some men. Other, more advanced and invasive therapies have also been described, such as neuromodulation and surgery. To achieve success in managing prostatitis, one should firstly follow the advice of his doctor and try any prescribed therapies. Symptoms can further be managed with some simple lifestyle changes. Eating a balanced diet, low in alcohol and caffeine, and complete with essential vitamins and minerals, and perhaps low in spicy foods, may help ease symptoms. Keeping your weight to a healthy level through good eating habits and regular exercise is also helpful. Regular warm baths and the use of cushioned seats can help relax the muscles in the prostate and pelvic area and take pressure off of them, which can also provide relief. Finally, as stress can be a contributing factor in chronic prostatitis, stress management techniques and even counseling may be recommended to you. Many men are concerned about the effects of prostatitis on his partner and may also be worried about an association with cancer. Take comfort in knowing that, indeed, prostatitis is not contagious, and it does not increase one's risk of prostate cancer. There has been intense interest in the field of prostatitis research in recent years, and great strides have been made, leading to a better understanding of the disease process. This is leading to better diagnostic tools and more focused and effective treatment. In summary, prostatitis is a spectrum of diseases of the prostate, with chronic prostatitis, chronic pelvic pain syndrome, being the most common. It is a very prevalent problem among men of all ages, affecting 2 to 10% of them. Symptoms of prostatitis include pain in the pelvic area, back, and abdomen, sexual symptoms, such as painful ejaculation, and urinary symptoms, such as urgent and frequent need to urinate. The diagnosis of prostatitis syndromes relies on a careful medical interview, physical examination, and certain lab tests. When bacterial prostatitis or infectious prostatitis is suspected, treatment can be successful with antibiotics. Treatment of chronic non-infectious prostatitis or chronic pelvic pain syndrome focuses first on the early diagnosis and removal or treatment of any suspected triggers. From there, management is focused on improving symptoms and quality of life through lifestyle changes and other measures, such as anti-inflammatories and pain medication. Treatments for this condition are discussed in much more detail in a separate module. It is possible to lead a normal life while undergoing treatment for prostatitis and afterwards. And medical research continues to forge ahead in the hopes of improving the diagnosis and treatment of this troubling condition. These resources available on the Internet may help you find further information or support about your condition. These current references were also used to assist in the preparation of this module. All of these are available through your local medical library if you are interested in more detailed reading on this subject. We sincerely hope that this module has furthered your understanding of prostatitis. We wish you the best for the future, and thank you once again for viewing this educational program.